Dannenhoffer, the Public Health Officer for Douglas County. This is another of our Facebook Lives. It's now September 18th. We've been doing these for about 6 months now. And we start the same way. I model a mask. This is one my wife made. It's really one of my favorites. It's a little bit bigger, doesn't move as I talk. And it's got this little string thing on the back so I can easily take it down. I'm going to take it off now because I'm appropriately socially distanced. And we'll get started. This has not been a good week with the fires, with the smoke, with the possibility of floods now. This has really been a tough week. And while last week I could say, well, the only good news was COVID, I can't say that today. The word on COVID is really very grim in this last week. Let's start at the top and move down. This is also your time to ask questions. So in the world, we're at 30 million cases. We gained 10 million cases this month. Really a sign that this is a spreading pandemic. We're at 950,000 deaths worldwide, and we've been stubbornly stuck at 250 to 300,000 cases per day, and deaths at 5,000 per day. So again, that's a case fatality rate of only a little bit more than like 2%, suggesting that this is not because we're just catching a lot more disease. There is a lot of disease out there, still very active in India, Brazil, US, and pretty much all of the Western Hemisphere, except for Canada and Uruguay. Also becoming now very, very, very strong in Spain, France, and Israel. Israel is, for me, perhaps the biggest concern. Israel has taken pretty much a similar approach to the United States. They had an early peak. They put some restrictions in, and they were able to get over that first peak. And so there was a real sense that they were able to get this down, and the thought was that we may follow. They opened up, they opened widely, they opened up schools. They opened up schools when the rate was a little higher than the rest of the world, and they had lots of cases. They had to close down schools again. They opened up again, and now they're seeing an incredible spike in cases. Almost as many as the worst places in the U.S. at the worst times, so much so that they're having to go for another 3-week lockdown. And unfortunately, what I saw is the cases came down. They weren't down quite enough. They opened up, and as they opened up, disease spread, and it took about 6 weeks for disease to spread from the schools to households, from households to other places, and then to places where people who are sickly, hospitals and long-term facilities, congregate, and then they see lots of cases and lots of deaths. I really hope we're not going there, but if you look at the data on Israel, I think it probably is, for me, about the most concerning in the world. Now, there are places that are still doing great. Sweden, Norway, Finland, all doing fine. New Zealand, Australia, Taiwan, Korea, all doing well, keeping the case count low. So when you look at Taiwan, they've had 500 cases total, and they go days and days without a single new case. New Zealand, they average 1 case a day in the whole country. So there are places in the world that have kept it going well, but India, Brazil, the US, and now Israel, really, really concerning. In the US, we're at 6.8 million cases, and depending upon how you do the counts, we're right at 200,000 deaths. 200,000 deaths is a lot. Certainly far more than we ever see with flu, as many as we've seen in many wars, so a lot. And the case counts are high. Over the last 3 days, the case counts have been 40,000 plus per day, and the deaths are still high at around 900 to 1,000 deaths a day. The cases went up in the beginning. They came down in May. They started going up again. They went up in August, and they came down, and the hope is that they would continue to go down. But in the last week, they've started rising again, eerily similar to what they saw in Israel, but a few weeks behind. In the U.S., when you look, very active still in Texas, California, and Florida. But now what you're starting to see is Wisconsin, North Dakota, South Dakota, and other states that were not previously really affected before really get quite affected. In Oregon, we're at 30,000 cases and 500 deaths. Our RT, which is our reproductive numbers, now crept over 1, suggesting that the amount of disease in Oregon is starting to creep up again. Still, though, Oregon's got the 4th lowest attack rate in the country. And when we look at the cases, though, we're starting to see cases now still in Portland area, still in the Malheur County area, but now we're starting to see a spur of cases in Jackson County, Lane County, and unfortunately now Douglas County. So Douglas County, where we broke the 200 case mark, certainly not something to celebrate, and we're still at 3 cases, but we're 22 cases this week, and I think we are 5 cases today. You know, we've not seen this number of new cases for months, because we had our little spurt in March and April, went down in May and June, then we had another little spurt in July, and then we've knocked it down, but now it's starting to come back. These cases are especially worrisome because with these 22 cases, we've seen 6 hospitalizations, some of whom are very sick, and we may have additional deaths. These cases, though, all came before the fires, and we think almost all before Labor Day. So still, we have not seen the effect of the Labor Day holiday. We've still not seen the effect of the fires, and we've still not seen the effects of school reopening, all things which really could add to it. The fires especially are real risk for being a COVID event. And the reason for that are several. One is we were grateful that we had firefighters from around the country come to help us, but many of those firefighters came from Georgia and Florida, 2 areas where there's a tremendous amount of disease, and they came to our county. Now, they mostly stayed by themselves, but they did have to come into town to get things. They did go into town to register and whatever else, so we are very worried that's going to do it. The second thing that happened with the fires is that people were worried about the fires, not unreasonably, and thought less about social distancing and using masks and such. The third is that now we've had a lot of displaced people, and many of those displaced people are staying in larger family groups than they otherwise would. So they moved in with family or they moved in with friends, and now the group has gotten bigger, which increases the risk for spread. As I said, though, we have not seen the effect of that yet. What we're seeing is the effect of stuff that happened at the end of August and the beginning of September. What we've seen is a very complex group. We have not sorted out all the details. Mostly older people, mostly centered either in the far north of the county and the far south of the county, but they have contacts between them, and we've been able to tease out some of those contacts, which seem to happen with social groups, with little social gatherings, with craft groups, and maybe with a restaurant or a church. So all of these things that are doing it, and this is a really serious one because this is related in 5 hospitalizations, and as I said, some of these people are really very sick. So we do worry that there's more tentacles here that we've not gotten to the bottom of. So it really is worrisome. And so when we look at our cases, they so frequently have a couple of problems. One is travel, so we've had 2 associated with travel. Travel then associated with family gatherings, frequently big family gatherings, without the use of masks and other kinds of protective measures. So please be careful, because right now we have it under control, but boy, if it continues like it was today, it won't be long until we do not have control. Okay. So somebody asked, can you explain what contacts of contacts need to do? So let's think of it this way. So I have the disease, and I'm exposed to my wife. We've been together without use of masks, and so she would be a contact, and she would be asked to quarantine. And she would be asked to quarantine for 14 days. To be a contact, you need to have fairly close contact, 15 minutes or more at 6 feet or less. Obviously, my wife and I have that kind of contact, so she would be a contact. Now, let's say she went to visit my daughter, and I did not visit I did not visit my daughter, but she did, and had 15 minutes or more of close contact. So if I had the disease, my wife would be the contact. My daughter would be the contact of a contact, assuming that she's in direct contact with me. She would not need to quarantine. She would not need to do anything different other than we'd ask her to be on the lookout for symptoms. Now, the recommendation would be that my contact, my wife, get tested a week or so after the contact to see if she's positive. And then if she's positive, then my daughter should also be quarantined. given the fact that this disease usually takes 5 or 6 days to show up, that's a safe way to do it. You could quarantine contacts of contacts and contacts of contacts of contacts, but if you did that, a lot of people would be in quarantine and you would only be saving a few new cases. Again, the best thing to do, since there are so many asymptomatic cases, is to practice social distancing, wear a mask, and be very careful about travel. So do our new cases bump us back to having to close schools? Well, not our cases. The state positivity rate went up this last week, and the state positivity rate went up this last week, not because there were more cases, but that there were fewer negative tests. So I have spent many hours yesterday and today trying to figure out how that impacts us, and we'll know by Tuesday. So can 412 start schools now? The state level is 5.4. Again, I've been on the phone for hours and on email for hours today with ODE to figure that out. Yes. So Casey says, is it a concern that we had lots of visitors from California, Washington, and other places in August or September? And the answer is yes, it is. And we had a lot of visitors in the beginning of September from Georgia and Florida who are helping us to fight the fires. Visitors are a problem because when visitors come from areas that almost certainly have more disease than Douglas County, and thus they increase the risk. However, when we go back, most of the travel we see are Douglas County people going somewhere else, picking up the disease and coming back. Sorry about that. Picking up the disease and coming back. So that's what I worry about. So Misty says, can you talk about how contact tracing is working in Douglas County? Well, the point is I think contact tracing is working as well in Douglas County as anywhere. We have 3 excellent teams that have a lead, contact investigators, contact tracers, and support specialists. So when somebody is a contact, they call them every day to see how they're doing. They give them whatever they need so they can bring out thermometers and food, pulse oximeters, whatever. They very carefully follow them. They do very careful interviews to find out who they might be around or who they may have spread it to. So we're really doing it correctly, but we can only do it correctly. We have a couple of advantages. One is the county has been incredibly supportive when we need to hire people to do it. The county has been remarkably supportive, say, Bob, get what you need. The second thing that has helped us was that there are 3 people in the group who are trained in sort of doing diseases. So Brian Mahoney, who has worked with us for a couple of years, has an incredible career with the CDC, working on, and World Health Organization, working on polio eradication, working STD treatment, working on environmental health. This guy's amazing in what he knows. So he helped us to form our contact tracing thing right away. Many other places don't have that. We also have a woman who worked in the Gambia, and so she knew about tracking disease, and I know something about it. So we had 3 of us who really knew what we were doing. So we got started in March. Most places didn't get started until June or July. So we had a big lead on that. The third thing that happened is we never got overwhelmed. If we were like Malheur County had 100 cases in a day, there'd be no way we could do the stuff we were going to do, and we just have to sort of nibble at the edges. Because we've never had a lot of cases, we've been able to track all these cases down within the first day. We've been able to reach their contacts within the first day. If people need things, we can go out and do it. But if we had, like Lane County had yesterday, 28 cases, or like Marion County frequently has 30 or more cases in a day, we would never be able to stay on top of it. And that's another reason we need to keep it down. So I think Douglas County is going well, but not so much elsewhere. Okay, so let me tell you about some other things that came up this week. One of the questions, can you get it again? So you guys ask questions, and then sometimes, well, I don't know the answer to that one. And the reason I don't know the answer is that because I really don't know the answer to it, but I keep looking it up. And so when the information comes, I now have the information. So the question is, can you get reinfected again? And the answer is now incredibly clearly yes. So there are 2 very well-documented cases, one from Hong Kong, where somebody had the disease. They had a mild case the first time. They then went to Spain to visit and came back and got it again. They actually had the viruses from each time and could show that the viruses were very different. So when that Hong Kong And the second time, the person was asymptomatic. So that Hong Kong case was reassuring. It's like, well, yeah, you do develop immunity, and while you may get infected a second time, you don't get very sick. A few days later, there was a case from Nevada. Same story. A person had it before. They had it positive. They actually still had that virus, got sick again, and they checked, and they clearly had it again. It was a different virus. So yes, you can get infected again. The problem in the Nevada case is this person was really sick the second time. 25-year-old, sick enough to be in the hospital, and still weeks later sick. That's worrisome for both getting reinfected and also worrisome that the vaccine may not protect us as much as we think. So can you get reinfected again? I think the answer is clearly yes. The second is immunity from the first time protective? On the basis of one case from Hong Kong, maybe, and on the basis of one case from Nevada, no. And so that could certainly have an impact on the vaccine. Other things that came out, there is some good news. One good news is because in other parts of the world where they're using lots of masking, there's a lot less influenza. And so we're hoping also that because we're using more masking and we're social distancing and washing our hands more, that we'll also have less flu. And that would be good because having flu and COVID together, it just makes it incredibly complicated. The other thing that came out is about a monoclonal antibody. I've been talking about this for months now. So monoclonal antibody is you get somebody who develops an antibody to COVID. This antibody seems to be effective. You now make it in the laboratory and give people a concentrated dose of that antibody early on in the disease to help prevent it from getting worse and getting sick or being hospitalized. They gave it, 300 people, seemed to decrease the rate that you would need to go to the emergency room and get hospitalized from 6% to about 2%. So that's worthwhile. It means that it didn't help 97% of the people, right? So the only people helped are the 3% that went down. But still, stopping the number of ED visits or decreasing the number of hospitalizations and decreasing the number of hospital visits is certainly worthwhile. Again, I would call that a solid single, but certainly not a home run. New things that came out this week about the vaccine side effects. So Moderna opened up their whole trial, so you got to see what goes on there. And it looks like the Moderna trial has not had any bad side effects, although the newer data isn't in there. The AstraZeneca vaccine, which is the vaccine that's being done over in England, you remember there was that weird transverse myelitis that developed in somebody who'd gotten the vaccine. The UK has reopened the study. The United States has not, because that's the kind of side effect that you'd really worry about. The other thing that came out was that these vaccines need to be stored at super duper cold temperatures. I mean, super duper cold temperatures. So they're saying that I have to figure out the numbers because they're unbelievable to me. When you look at the AstraZeneca vaccine, the AstraZeneca vaccine, it needs to be stored at negative 10 degrees Celsius. So it's pretty cold. That's colder than most people's freezers. The Moderna vaccine at negative 20. Let's do these in Fahrenheit. So the Moderna vaccine at negative 4 degrees Fahrenheit. That's cold. I mean, most people's freezers are in the 20s. The Pfizer vaccine at negative 4 degrees Fahrenheit, but the other one at negative 94 degrees, the Pfizer vaccine, negative 94 degrees. So that's really, really cold. That's right at the temperature of dry ice and only a little bit above liquid nitrogen. The problem is, who's got a freezer like that, except if you're in a research lab that has liquid nitrogen cooled freezers, you're going to have a really hard time storing it that cold. They're working on it and they have all kinds of workarounds to try and make it work. That could be a big problem, right? Because right now I'm not sure we have any of those freezers in Douglas County, and because people have found this out in the last few weeks, you can't even buy them. So we'll see what happens there. So can a person on blood thinners get a vaccine, Kathy asks. The answer is you need to talk to your doctor. Usually yes, but it depends upon what kind of blood thinners you're on and for what reason. So you really need to talk to your doctor. So, for example, I have a kid who's on blood thinners because he's had a heart transplant. No, he shouldn't be getting the vaccine. But other people on blood thinners because of a blood clot in the legs, and they could. So it's very specialized. So I'd ask your doctor. So Carolyn says, has more been learned about the long-term effects of COVID? Again, remember, it's only 6 months out, so it's a little hard to know. But we have learned that there are some long-term effects. There are a lot of people who are still quite symptomatic after 2 months or 90 days or 100 days, depending on how you do it. So there's still a lot of people who are not feeling well that long in. So we're calling these long haulers. And when we looked at our people who were the first ones sick in March and April, 80% of them still had a fair number of symptoms. Only 20% said they were back to normal. So yes, symptomatically there is, but we're also starting to see other things. So some high number of NCAA athletes who had COVID, even very mild COVID, have myocarditis, which is an inflammation of the heart. That was pretty shocking because many of these people had barely symptomatic cases, and yet they have myocarditis so bad that they're not allowed to return to play. One study said it was a third, one study said it was 15%. So it's some number in there, but it's a significant number of these young, very healthy people who have long-term heart damage. There's also a concern about long-term lung damage. Pulmonary function tests for many of the people who were sick early on. CT scans are still not back to normal. Whether they're going to get better with time and heal with time, I don't know. But at least for now, they're still not back to normal. So long-term effects of COVID, really not nice. So Linda said, I got hives from my last flu vaccine. Had to get cortisone. Should I try it again? So this is clearly one to talk to your doctor about, because hives are really complicated. And so you really need to talk to them about why you got the hives and and if you were going to get the vaccine, what you might do the next time. So for people who are prone to hives, and there's some people who are, some people can get vaccines with precautions, but if you had a truly anaphylactic reaction from the vaccine, you should not get it. So you need to talk to your doctor. Okay, so schools, some schools have opened up, other schools are planning to open up. The specific rules on that with the change in cases, we're going to find out hopefully this weekend. A couple of other things that happened here. We had talked about the doppelganger analysis, where we looked at other states that had lower restrictions and see what happens. And the data that we presented about a month ago kind of holds that the places that had more restrictions, like Oregon, so there is, believe it or not, this website that ranks the level of restrictions. So Oregon is 44, which means is 44th out of 50 most restrictive. The counties we looked at were the other states, Georgia, South Dakota, and Idaho, were 1, 10, 11, so not very restrictive. And again, we also have seen their unemployment rates. Again, Oregon's unemployment rate is a little higher, the death rate much lower, and so I think there's no free lunch. This is a terrible virus, and this is a terrible virus that if you do less restrictions, you may have more cases and more deaths and less economic impact, but still enormous economic impact. Places that have more restrictions may have fewer cases and fewer deaths and more economics. And that's why it's up to our elected leaders to pick a reasonable midline course. Yeah, so how would a person even react to a vaccine that cold? Yeah, so I think from what I've read, and again, this isn't out there yet for us to know, the story is they need to be stored at that temperature, and then they need to be warmed over the space of a period of time, and then given while warmed. So again, when most of our vaccines are refrigerator temperature, it doesn't take very long to warm them. In these cases, being stored so super cold, you can't even touch them, right? Because you get frostbite, your fingers will stick to it if you touch it. So how do you deal with these? We don't know. We've never dealt with a vaccine that's cold. The coldest vaccine we deal with now is chickenpox, which is around 0. So not as cold as the warmer ones. I don't know what you do with one that's negative 94 degrees. Yeah, so Clover says, how safe is the pool at the YMCA? Have there been any indoor pool super spreader events? We don't know of any super spreader events in pools. In fact, we don't know of any spread at pools. I mean, in general, in pools, you tend to be far away. There's a lot of chlorine there. This is not a very strong virus against chlorine. So chlorine, we think, would kill this virus very quickly. So no, we've not seen any super spreader events. However, pools have been very safe. Pools have really distanced people. They want to be sure that there's no outbreak. So we've not seen any, and I don't know of any super spreader events anywhere in the world associated with pools. Now, a lot of times pools are associated with the things that happen right outside the pool. There have been cases of super spreader events at places that have pools. So you've seen this thing from the Ozarks where there was a zillion people kind of in a pool drinking and partying and kissing and whatever around the pool. Things there would spread, but I think if you go to the pool, maintain your distance, be there to swim, the risk is minimal. So can I reiterate again how many problems we're seeing with domestic travel? Okay, well, I have my list here. We only have 200 cases. We have seen 4 from Alaska, 4 or 5 from Washington, 5 from California, 1 from Arizona, 1 from Nevada, several from Idaho, 2 from Wyoming, 1 from Michigan, 4 or 5 from Louisiana, 1 or more from Florida, 1 from Texas, 1 from Ohio, 1 from Tennessee, and 1 from Massachusetts. So I haven't added up those numbers, but it's a lot. So domestic travel makes up a lot of the difference. And again, not surprising. You go to a place where there's a lot of disease and you do the normal things you do, you are much more likely to pick it up. Now, I'm sure more than the 30 or 40 people that got it through domestic travel have traveled. I'm sure there have been hundreds or thousands of people from Douglas County who have traveled. So it's not like you're guaranteed to get it if you travel, but you're much more likely to get it if you travel than if you stay in Douglas County where there's very little disease. And again, as I said earlier, our big concern is we had about 800 people here fighting the fires from Georgia, Alabama, and other states where there's a lot of disease. So remember Lowndes County in Georgia, Valdosta, not the hotspot of Georgia. They've had about 15 times as many cases as we have and continue to have every day 30 or 40 cases a day. Again, we think this is a bad week because we've had 22 in the week, but they're having 30 or 40 cases a day. So, we are really concerned that the firefighters may have brought some COVID here, shared it with local people, and that may show up in the next week or two. So Bob says, if you think you've had COVID in the past, can you get tested later to see if you've had it? And the way to do that was with an antibody test. Now, antibodies are the natural protection that your body makes. I think the data is very good now that most people make antibodies. They typically make antibodies most predictably 2 to 8 weeks after the infection, and it's 90% or more of the people make that. Now, there's a couple of issues. One is if you get tested too soon, you may not have it. If you get tested too late, the antibody level may have already fallen. So if you think you've had it, the right time to get an antibody test is 2 to 8 weeks afterwards. You can still get it after that, and if it's positive, you still likely had it. Early on, there was some concern about some really crappy tests and a lot of false positive and false negative. But if you get it at a big lab, Mayo, Quest, LabCorp, they are pretty darn accurate. Okay, a couple of other things, and then we'll call it a night. This has been quite the week. One of the things that we talked about early on was the case fatality rate and the infection fatality rate. So the case fatality rate means that if you find everybody who's diagnosed with the disease and then look to see what percent of the people diagnosed with the disease die, you can get sort of an idea of what the case fatality rate is. So what's my chance of dying if I get it? So overall, for example, in Oregon, we've had 500 deaths and 30,000 cases. So if you do it about 5 in 300, so about 1.6% case fatality rate. The other thing to look at is the infection fatality rate. So if you truly knew who had the disease, based on, for example, antibody studies, and then look to see what the infection fatality rate is. So the infection fatality rate takes both the diagnosed cases and the undiagnosed cases, and so obviously that rate is lower. That rate is stubbornly about 0.6, maybe a range from 0.4 to 2%. So about 1 person in 200 who gets infected can get the disease. About 1 or 2 out of 100 have been diagnosed will get the disease. Again, very, very variable by age. And so younger people, much less likely to get really sick or die. So we've seen in these college outbreaks lots of cases, but very few hospitalizations and no deaths. However, what happens predictably in these things is it goes to the campus. Lots of students go to parties and whatever, and they get it. The problem is they don't just stay among themselves. What they do is they go to class where they have older professors, like my sister or me or my brother, who both are professors at universities, and they maybe infect the professors who are both in their 60s and have underlying health conditions. Or they, as students do, they work at a nursing home, and they then spread it to people in the nursing home. Or they spread it to a parent. When the parent comes to visit, they spread it to the parent, and then the parent brings it back. And so as colleges open, we really expect to see lots more cases. In fact, we had one today, again, from colleges as colleges open up. So again, this is a real risk. What we saw was that first peak, then we saw that second peak, and it came down. We thought, well, maybe we've really got it. But now we're starting to see this, either the beginning, I would call it the third peak, anybody who quibbles with that. The third peak, we're beginning to see the beginning of the third peak. And this third peak is really worrisome. Remember, we had no hospitalizations for weeks at a time. We've had 6 in the last week. We had no deaths. We're now going to likely have a few. And so really, 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 this is the time to be careful. Okay, any more questions? We have one more, 2 more, 1 more. We'll do the 1 more question. And then we'll get going. So again, a couple of things. We have a couple of challenges here. One is the crisp $50 bill. If you can show me that there's this internet thing that's out there that, I went up to a testing event, I never got tested, and I got a positive result. I haven't seen one of those in Oregon, and haven't seen a single one of those in Oregon, and there's a crisp $50 bill for the person who can show that. And then the second one is, people say, well, all these people have been called COVID deaths. They really don't have COVID. They really have other things, and the COVID was just a transient thing. I want you to show me a case. Again, there's a $50 bill in it for there. The deaths that I know about, these are from COVID. And you almost never die of the underlying disease, right? So when you die, when you're in a car wreck, you don't die of the car wreck. You die of the ruptured spleen that led to exsanguination, that led to your death. Your cause of death wouldn't be the car wreck. Your cause of death would be exsanguination, secondary splenic rupture, secondary to the car wreck. Nobody would suggest that the car wreck wasn't the cause of your death, and that's how it is. So again, if you can find me one where a perfectly healthy person who just has a little bit of asymptomatic COVID dies and gets counted as a COVID death, there's $50 for you. And the question is, do I feel smoke increase these hospitalizations? Perhaps. So what happened, we had magnificently horrible air this last week. So I look at I look at a lot of things, but one of the things I look at every day is the PM 2.5 level. So the PM 2.5 is particulate matter of the size 2.5 or smaller. So it's very, very small stuff that you can't individually see, but when together you can see as smoke. That's the stuff that gets deep in your lungs. Again, big stuff doesn't get into your lungs. Big stuff gets stopped at your nose or your throat, but it's really those tiny particles that get into your lungs. And cigarette smoke has a lot of it in it, and this wildfire smoke had a lot in it. Oregon has some of the cleanest air in the whole world. You only have to get to the top of the mountains on a beautiful, clear day. You can see like miles and miles and miles. One of the best parts of going skiing is getting to the top of the hill and looking and seeing these other mountains that are 50, 100, or 200 miles away. That is like epically clean air. And so when we look in Oregon, and I look at these numbers, very frequently the Douglas County numbers are 5 or 8 or 10, some incredibly low numbers. At 50, we start to get worried. At 100, it gets unhealthy for some groups. But this week, we were over 500 for days at a time. And clearly, that impacted people's breathing. However, these people, this was not just smoke exposure. These people were profoundly hypoxic and really quite sick. Smoke exposure certainly may have exacerbated, but didn't cause that. It was clearly their underlying COVID that did it. We have checked to see if smoke increased other hospitalizations for people with asthma and COPD. And so there's a state system that the state has called Essence, and it looks at ED events. And so you can look at ED events over time and whatever, and you can see what happens. And so we've been following Essence to see if this led to an increase in ED visits. Haven't really been able to see that. We talked to people at the ED. Haven't really seen a lot of increased hospitalizations due simply to smoke. We may get it later because, again, a lot of these problems don't show up right away. They can take a little while to show up. One of the other things that the Essence system we've been looking at is suicidal attempts. So suicide attempts are incredible worry. One of the concerns we have with COVID is that either you get depressed or anxious because you're worried about the disease. You get depressed or anxious because somebody you know has had the disease and has been really sick and dies, or you may not have a lot of cases, but then you have more restrictions and you are suicidal or depressed because you haven't seen your friends, because you haven't been able to work, because you have financial troubles. And so we've been worried about the risk of increased suicide. We've talked to our medical examiner. They've not seen it here locally, increased risk of deaths from suicide or drug overdose, but we're watching it. The other things we look at, though, is we look at people who go to the emergency room with suicide attempts, who don't die, obviously, who have suicide attempts, and look to see if those are up. And those do not appear to be any different this year than they were in the past. But when you talk to people who study suicide, what they say is that the suicide rate doesn't always increase the first day, but it increases later as people are adjusting to the trauma. So again, you do have some soldiers who were active duty in Afghanistan and Iraq and whatever who committed suicide, but far and away the biggest toll was when either they came back to the U.S. or when they got discharged and went back home and had PTSD or something else. So we are really concerned that what we're going to see is that as this piles on and people out of work for a longer time, or they're constantly in the fight or flight thing because they're so worried about the virus, that we may see some increase in suicide in that. Now, I will tell you, the places in the world that have done the best and have the less mental health stress are the places that have really beat this back. So all of Taiwan's a big place with lots of people. They've had 500 cases total. New Zealand has 1 case a day. Australia, 1 case a day. I actually got to talk to a fellow in Australia about a case, and we were talking about it here, and Australia takes this seriously and they do all those things. I said, well, what's your life like? It's pretty much back to good, as he said in his lovely Australian accent. Pretty much back to good, where schools are open and things are open, and we're doing well. We're still very vigilant, but things here are pretty much back to normal. And the way they were able to do that is they were able to bring the case count so low that when they do get a case, they can track it down. They had a little outbreak here associated with one province. They were able to lock it down and get it done. New Zealand had a few cases. They were able to lock it down. And so the places that have gotten this down and able to lock it down, they've actually had the best apparent mental health outcomes. So we need, we still in this country are having a lot of disease. And so we have both. We have the worst of both worlds. We still have more restrictions than other places and more cases and more deaths. And the deaths really take a toll. I'm from New York, if you can't tell. But I'm from New York City, where when I talk to people I went to high school with and whatever else, they're still reeling from the deaths that they had. You don't get over the death in a week or two. These people who had friends, relatives, patients who died are still struggling with that. So again, we need to do everything we can do to keep our case count low. So what are my recommendations? First is no need to panic, but what there is reason to do is a couple of things. One is be very, very, very careful about travel. If you do travel and come back, that's okay. If you even got there, quarantine for a while before you go back to work. The worst is to come back, and I know people come back and they don't want to use up their vacation. They come back and go to work and then expose everybody here until they figure it out. So if you do have to travel, either quarantine before or after as best you can. Second thing is be really careful about those social groups. That little card party, that little dinner that you have with 5 or 6 people, if one of those 5 or 6 people is now brewing the disease, they've exposed you. So if you have one of those parties over the space of a week or two, that's one thing. But if you have, a couple a day, you had lunch with this group and then sewing circle with this group and card party with this group and then went to the casino with this group and whatever, it really exposes a lot of people. And if you're somebody who's in that pre-symptomatic super spreader phase, you can really infect a lot of people. So again, 22 cases this week, many related to this group of travel and social circles that we really are worried about. So be careful. The only good news on that is that we think most of that transmission occurred late August or early September. So we may have already nipped it in the bud, but be careful. And then be careful if you had exposure with the firefighters who came in, especially those from Georgia and Florida, because you could certainly do that. Now, people said, well, why didn't you test them all before they left? Well, testing before they left would not have been terribly helpful for a couple of reasons. One is they were not here that long, and if they got the disease in the 5 days before you tested them, then the test wouldn't show that. The second thing is, when you now have the test, you now have to track them down where they went to, and many of these people will be in other fires. Some of these people will be recuperating after an incredibly hard week of firefighting. And so the recommendation was not to test them as they left, but certainly to test anybody who is symptomatic. Okay, one more question, and then we'll call it a night. No more questions. We'll call it a night. Again, this is Dr. Bob Dannenhoffer after a very long week. The good news is rain has come. Fire should be down. Hopefully we won't get floods. The air is much cleaner. It's now down to less than 50 on the PM 2.5 scale. Again, we do have a lot of cases, but hopefully we've nipped it in the bud and we all have a chance to stay safe and be kind. Thank you.